As a female runner over the age of 45, running with pain can feel confusing. Should I stop? Should I carry on running? Should I call a doctor? Today, Lindsay and I are going to cover the 7 crucial questions to ask yourself when running with pain. They're often overlooked, but we're going to address each question and give you some guidance about what to ask yourself and whether you should be running or not. So the first question to ask yourself, is this pain sharp or dull?
Yeah, so really, if a pain is sharp and intense, that normally points to an acute injury, and an acute injury is always going to require some form of rest. If it's a dull pain and it kind of comes on over time, then we can have some discussions around whether it's something you could potentially work through.
Great. So now think about, when did the pain start? Did it start suddenly or did it gradually build up over time?
Again, such an important question, because the sudden onset of pain again points to something acute, and then we know it's time to rest. If there was a gradual build-up of pain, that points to something more chronic, but also because it came on slowly, that presents an opportunity to maybe train in a different way, so potentially adding in cross-training or modifying the training in some kind of way, reducing intensity, frequency, those kind of things, and that may allow you to then continue training.
Now ask yourself, does the pain get worse progressively as you're running?
Yep, that's a critical question, because obviously if something is starting to get sore as we go, that's a really clear indication from your body that you actually need to stop what you're doing.
Right, Lindsay. So next, I like to check in after I've finished my run. So I like to check in immediately after I've run, then maybe 2 hours after, and then the next morning and how the pain's feeling.
This is particularly relevant, Nicky, when you have an injury that actually feels a bit better when you run. So sometimes you'll start running and the pain will subside or go away. And then you really want to track, okay, but how do I feel immediately after, within 2 hours? Does it go away with rest? And again in the morning. And you're not only wanting to track how it's feeling, but how is it feeling relative to how it was yesterday. So again, this is one of those, is the pain progressing, staying the same, or getting slightly better? Because those are literally the things that you're going to use to make a decision. Similar to if it's progressing during the run, if it's progressing run to run in that 2-hour window or the next day, then you do need to either stop or definitely modify. For example, if you don't feel it at all in the 2-hour window, but then you are feeling it when you wake up in the morning, that might just mean an extra day of rest or 2 days of rest. So we can fiddle with the frequency, and that then may allow that injury to start healing and getting better and better as you go.
Here's a big one. Do you include your mobility and your recovery? Do you include these, be honest with yourself, in your weekly, daily routines?
Exactly, Nicky. Ultimately, recovery is probably the biggest determinant of how high your injury risk is. So if you aren't including conscientious recovery into your routine and doing your mobility, you're only increasing your risk of hurting yourself. We know that not doing mobility reduces your range of motion. When you reduce your range of motion, it means you spend more time at the extremities, and that places you at greater injury risk. We also know that if you're not allowing your body to recover, you're not going to improve, because in the absence of recovery, you can't improve from the training that you're doing. But we also know that you're increasing your risk of running in pain and then ultimately ending up getting injured. So make sure you end every session with some mobility and build in rest days and recovery weeks into your training cycles.
Nice one, Lindsay. Great. Right. Okay. So when you are running with an injury or a niggle, you tend to compensate in other parts of your body. So be honest and ask yourself, what is your running form like? Are you compensating for that injury or niggle?
Yeah, so effectively, if you are changing the way that you run to compensate for something that is sore, maybe you've got a slightly sore knee, but if you run slightly differently, you don't feel that pain. Unfortunately, what happens is that you start to put strain on a part of your body that's not supposed to take strain. And that often leads to chronic injury. So they build up slower over time, but then modifying training doesn't really help them because it's coming from a specific stimulus. And so we really want to avoid changing the way that we run. And if you feel like you're changing your gait, or if people are asking you, is there something wrong? Because sometimes we don't actually realize we're doing it consciously. So if other people are noticing that we're running differently, or you feel like something is different, or you're picking up like a dull pain in a different part of your body, that's a clear sign that we need to have some kind of intervention so that we can heal the pain that's causing us to compensate, but also make sure that we don't develop a chronic injury.
And finally, ask yourself the big question: should I rest or should I seek professional help?
So Nicky, when we're dealing with pain and discomfort, it's probably always a good idea to seek some form of professional help. Once you've gone particularly to an acute pain or a pain that's progressing, knowing what is causing the injury or why goes a long way to helping us fix it. So I'm a fan of going to a medical professional like a doctor or sports physician first, and then potentially getting some physiotherapy. What seeing a professional is going to do is always shorten the cycle of the recovery time or the time out of running.
Now that you know the 7 essential questions to ask yourself when running with pain, I'd like to invite you to our free online masterclass for female runners over the age of 45. It's packed with expert advice and strategies that will help you run pain and injury free. The best part, it's completely free. All you have to do is click on the link on the screen.